Hello, and welcome to today's webinar. My name is Dr. Lila McKenna, and I will be facilitating today's webinar. I serve as adjunct faculty with Florida Center for Nursing, and I also hold a full-time position as Executive Dean at Chamberlain University. I will be your moderator for today's session. This month, we continue our webinar series, Strategies to Strengthen Florida's Nursing Workforce, designed to highlight innovative strategies and practical solutions that support the growth, development, and long-term sustainability of Florida's nursing workforce. Our expert presenters discuss critical issues, share success stories, and provide actionable steps to enhance nursing recruitment, retention, and professional development across our state. Today's webinar is entitled Legacy in Practice: The Nurse Emeritus Role. It's a standalone session. We are pleased to welcome Dr. Fray and Dr. Grumme, who will share their insights and experiences regarding the use of Nurse Emeriti. Thank you for joining us for the live session, or you may be viewing the recording at your convenience to gain the valuable insights on this topic. The Florida Center for Nursing, our state's nursing workforce center, has been established in Florida statute to address issues of supply and demand for nursing, including issues of recruitment, retention, and utilization of nurse workforce resources. We address these through researching the supply and demand of the nursing workforce, piloting innovative projects, developing and sharing these practices related to nursing workforce challenges. The nursing workforce is facing a critical moment. As experienced nurses retire in large numbers, organizations are at risk of losing not only skilled practitioners, but also invaluable institutional knowledge, mentorship capacity, and cultural continuity. A Nurse Emeritus program offers a powerful, sustainable solution, re-engaging seasoned nurses to guide, mentor, and support the next generation. By formalizing these roles, healthcare organizations can strengthen workforce sustainability by retaining expertise within the system, support new nurse transition through mentorship and psychosocial guidance, enhance morale and retention across all levels of staff, preserve institutional knowledge that might otherwise be lost. It's not just about bringing nurses out of retirement. It's about keeping the wisdom of nursing alive for the future. This webinar will highlight how two leading Florida health systems, Jackson Health System and Memorial Healthcare System, are using innovative Nurse Emeritus programs to tackle workforce challenges, improve nurse retention, and foster a culture of legacy and learning. Our presenters will explain key components and organizational structure of a Nurse Emeritus program, discuss how the programs contribute to workforce sustainability, mentorship, institutional knowledge, retention, evaluate the program benefits for participants and active staff, identify strategies to implement or enhance Nurse Emeritus programs within the healthcare organizations. We also want to hear from you. We encourage participants to submit questions and comments during today's webinar using the chat function. We will address questions and comments at the end of the second presentation. We will also ask you to give us your feedback by completing the program evaluation at the conclusion of the webinar. Today's webinar is eligible for continuing education. We hope this additional value supports your ongoing professional development and participation. So thank you for joining us, and let's get started. We have a quick Slido poll to get a sense of your experiences. You can join directly through the link or use the QR code on your screen. The link is also provided in the chat. We want to know, does your organizational currently engage retired or seasoned nurses in any capacity? Okay, we're getting all the responses in. It's great to see a mix of experiences here, okay? All right, so we're seeing several organizations look like they might be exploring this idea. Let's get started with our first presentation. I am delighted to welcome back Dr. Beverly Fray, manager at Jackson Health System Center for Academic Partnerships in Miami, Florida, who will share how the Nurse Emeritus program is designed to re-engage retired nurses as mentors and guides for new-to-practice nurses. Welcome, Dr. Fray.
Good morning. Good morning. It's my pleasure to be back to talk about the Nurse Emeritus program at Jackson Health System. We started the Nurse Emeritus program because we believe in nursing's future, and we also believe in nurturing our young, not eating them, like the old adage says in nursing. So before I start, I'd like to give acknowledgements and recognize some of our leaders and supporters. Dr. Carol Biggs, who is our Chief Nursing Executive and our Senior VP of Nursing at Jackson Health System, whose baby, who really gave birth to the Nurse Emeritus program, along with some other leaders. Michelle Kligman, Dr. Michelle Kligman, our EVP and Chief HRO at Jackson Health System. Julie Staub, our past EVP and Chief HRO at Jackson Health System. Dr. Susanna Flores Villamil, my Senior Director and JHS Clinical Learning and Development Leader. Evel Michel, Dr. Evel Michel, Associate Director and JHS Clinical Learning at JHS Clinical Learning and Development Department. Annabelle Perez, Academic Specialist in the Center for Academic Partnerships, without whom we could not have done a lot of what we're doing. So Annabelle, big shout out to you. Andrea Socorro Sardi, our past coordinator, who helped us to onboard many of our residents and Nurse Emeritus, and she was the one who really spearheaded the documentation platform that I'll be talking about briefly. And our first cohort of Nurse Emeriti, Mercedes Braithwaite, Kenel Lazar, only man, Myrna George, Mary Amusu, Maud Beauvoir, and Alma Tomlinson. They were the ones who really paved the way and helped us to design the program itself. Residency coordinators extraordinaire, Sean Carillon, acute care coordinator, residence coordinator, Jessica Myers, acute care coordinator, Ellen Weeks, critical care coordinator, Dr. Michelle Gonzalez, ED coordinator, and Dr. Stanisha Cherie, critical care coordinator. This is the team that makes the Nurse Emeritus program go. So thank you. So this program was established in October of 2022. And as I mentioned before, we started with about 5 people. We had a dragnet, and we basically invited our retired nurses to come back for a luncheon, and we pitched the program to them. It was Dr. Biggs, Dr. Susanna Flores Villamil, Julie Staub, Dr. Michelle Kligman. All of those people spearheaded the drive. So who is the JHS Nurse Emeritus? It is a retired nurse, a Jackson retired nurse, no other retired nurse. It has to be a Jackson retired nurse, in good standing with the organization, of course, and someone who is willing to give back to Jackson and nursing's future. These are people who are vested in Jackson. They doggedly defend Jackson, and they love nursing. So what is the purpose of the program? It's basically to support our new to practice nurses in their process of integrating into the workforce at Jackson. Because Jackson is a big health system and we have our own culture. It is not very easy to navigate. And so it takes someone who's patient and someone who really knows the system to help our new nurses get around and basically to be acculturated. They ensure to ensure that their experience is a positive one, and also to allow our new nurses to gain real-time experiences with a Jackson retired nurse who can share their wisdom about navigating the ups and downs of the profession at Jackson. Our mission basically is to retain the best and the brightest, because we know that many nurses want to come to Jackson. And so we're very discriminating when it comes to who gets into Jackson. And when I say discriminating, and please don't take it in the wrong way, I mean that we make sure that we are taking the creme de la creme. We take from the top and make sure that those people get into our organizations, because we want the best for our patients and for our community. We are a community organization, and so we want to give back the best to Miami-Dade County. So how does it work? Each nurse emeritus is assigned to a group of residents, and residents are new nurses coming into the organization. Usually they have between 0 and 12 months of experience. They're new nurses. Most of them are coming out of nursing school. The nurse emeritus visits each on their unit and conducts one-on-one touch points with these residents. They also evaluate each resident based on certain categories. And these are the 3 categories on which they're evaluated: their emotional well-being and composure, integration and collaboration with the team, prioritization of tasks, and time management. And we decided to focus on these elements because we know these are the areas of need for new to practice nurses. We also know that many of our new nurses are Gen Zers, and the research shows that Gen Zers are the ones who are suffering from most emotional issues. They tend to be a little bit more anxious than our regular nurses, and they talk about these things openly. So we want to support them psychosocially, and that is the basis of the Nurse Emeritus program. So the Nurse Emeritus's primary responsibility is to guide and assist the resident with problem solving, so that they can, and this is the experience that they as Nurse Emeritus bring to the table. They have been at Jackson, they know the ups and the downs, and they can give advice, good advice, and guide these nurses as to how they should behave and what the next steps to take. So the touch points, what do they consist of? Nurse Emerita instruct residents to always speak to their unit leadership first, especially when it comes to work-related concerns, because as you know, Jackson is a unionized environment, and we want to make sure that we're not stepping on labor's toes, so to speak. We maintain a very good working relationship with our labor partners, and we want to keep that going. So if it's work-related issues, they follow the chain of command. They speak to their nurse educators. First of all, their preceptors, nurse educators, and then their managers. The nurse emeritus adjusts the duration of each touch point based on the resident's needs. And what does that mean? For instance, I am the nurse emeritus, I go to speak to my resident, and I realize that my resident is having a meltdown. So I go to I speak to the resident, and I speak to the manager and say, you know what, Beverly is having a meltdown or is having a difficult time. Could we remove her from the clinical setting for a few minutes, a few hours, whatever it may take, And so we can get to the bottom of the issue and someone else can take over. So that is one way in which the nurse emeritus may have to adjust the touch point session. Some touch points are very brief. They may just maybe 5 minutes, maybe 10 minutes, but on an average, they take about 30 minutes. In terms of their schedule, first of all, they're per diem, so they have no benefits. They're retired, so they're getting a full package. So they have a flexible schedule. And the flexibility is to capture both shifts because we have day residents and night shift residents. And we want to make sure that everyone is touched. Some sessions are also scheduled during some classes when they're in the classroom for the residency. So we make sure that everyone is being seen. So this is our current group of nurse emeritus. Elise Smythe, you'll be hearing from her later on. Sandra Goff, Tessie Ariano Sikam, you'll also hear from her. Myrna is here, Myrna Makatang I, Alicia Smith, and Donna Mundi. And among all of these nurse emeriti, we have more than 130 years of nursing experience at Jackson. That is phenomenal. That is really phenomenal. And this is our inaugural nurse emeritus group. From left to right, Mary Amusu, Mercedes Braithwaite, Maud Beauvoir. I must tell you, she lived in Boca Raton and she would drive to Jackson just to see her residents, even at night. Canel Lazar is our only man so far, and Myrna George and Alma Tomlinson. So what are our outcomes like? Because I'm sure that's what you're looking for. So we started a program, as I said, in October of 2022 with 6 nurse emeriti. And by December 2022, nurse emeriti had seen 200 residents. Yes, touch points were 257. So it means that some residents had more than one touch point. Touch points with leadership, 57. Number of emeriti was 6, and our turnover rate at that time, first we started out, our turnover rate in 2021 was 20%. By December, it had gone down to 10%. Now, I'm not making any judgment saying that this is all related to the nurse emeritus program. However, that was something new at the time. That's one thing we had done, and I believe that had some impact. We also developed a one-day training workshop. We developed the digital documentation system for the nurse emeriti. We developed a case escalation process, and we developed a handbook. And between 2022 and 2023, you see we had increased from 200 to 305 touch points. I'm sorry, residents seen, 305. Number of touch points increased from 257 to 1,360. Touch points with leadership went from 57 to 400. And we decreased our number, or nurse emeriti. We lost 1 nurse emeriti, so we ended up with 5. But as you can see, they worked their tails off. And our turnover rate went from 20% to 10%. And if you look at the average cost of an NE, it's about a nurse emeritus, it's about $31,000 per year. And remember, these are not full-time, they're per diem, so it's less. And the average cost of onboarding a new nurse is about $52,000, and this is from the literature. In terms, just a broad overview, between March 2023 and August 2025, you can see how many, we have broken down the nurse emeriti per, based on their special, well, not necessarily specialty, but let's, for want of a better word, based on their units. So nurse emeritus number 1, as you can see, I know that this is an ICU. The fallout among residents was the highest in the ICUs. So that's something to look at, because I'm sure many nurses come in thinking, oh, we can do it in the ICU. This is where we should start out as new nurses. But as you can see, that's where most of the challenges are. And so we've seen 557 residents, and actively with Jackson is 89%. So most of them remain with us. And the nurse emeritus, they're tracking them to see who is falling out, who's having issues. We escalate issues as needed to leadership. And just perspective, national versus Florida. Florida, the turnover rate among new nurses, 17.6. Nationally, it's 22.7, and at Jackson, it's 8.2% so far. So something is working. And I know I have to thank the nurse emeritus for all the work that they've done. My slide won't go. So now we're going to hear from our nurse emeritus and one of our residents. I'm not sure if Ma Bear was able to make it because she slept. She worked last night, but I do have Caroline Pestana. Caroline, can you turn your camera on and speak? There she is, Caroline. You can unmute yourself. I don't think she's hearing us. Carolina. Okay, let's move on. Alicia is one of our nurse emeriti, and she's right here in my office. Oh, there's Caroline. You can, Caroline, please unmute. I can't hear her. Okay, so let's hear from Alicia. Oh, come on.
Good morning, everyone. I am Alicia Smith, Nurse Emeritus with Jackson. So happy to come out of retirement and be helping these young nurses. And as Dr. Fray has said, I believe that we are making a difference with this young population. Sometimes they come into nursing believing that ICU is the best place for me because I only get to take care of 2 patients, but 2 patients that are very ill. 2 patients that cannot speak most of the time because they're intubated, and you have to do a lot of not only physical but psychological work with these patients. And when we touch points with the nurses, the new nurses, the residents, to find out what's going on, occasionally they're drowning, but they're afraid to speak up to the leadership on their job. Because as one resident said to me, I don't want them to think that I'm a failure, I can't handle it, I'm gonna lose it. I said, but that's why I'm here. You can unload on me. And I'm not your manager, I'm not your educator. Whatever you need to say, you can say it to me, and if necessary, I will escalate it up to my leadership team. And to give you an example of how we do that and how we protect to the best of our ability, the psychosocial needs of these residents. I had a nurse that was working in the ICU, and 7 months prior to her going to the ICU, her son was shot and killed in an incident in New York, 22-year-old young boy. And she was still grieving this son for 7 months. When I saw her on the floor, she was a basket case. She said, Alicia, today a young boy came in. He's 22 years old, like my son. And I saw my son again in that bed. And she could not make it through the shift. So I spoke with her and I said, we need to escalate this up. We need to get to the leadership and have them know what's going on. It's still too fresh. It's like an open wound for you. And maybe next week might be another one, or tomorrow might be another one. So I escalated up to Dr. Fray, who's my immediate supervisor, who then got Dr. Villamil on board. And we were able to reach out to the leadership at the Jackson South Hospital, who had no idea what this lady was going through. She did not mention anything to any of her leadership team because of fear that they would think that she can't manage. But when it was able to get to that point where we now are aware what's going on, they were able to find her another position within the hospital. So she didn't have to lose any of her benefits coming on with Jackson. She was still able to maintain her position here, but just in another environment where she was able to grieve her son. And these are just some of the things that we do. These are just some of the things that we do.
Thank you so much, Alicia. And now we have Caroline. Caroline, go ahead.
Hi, good morning. I was an part of the Nurse Emeritus program. Miss Elise was my Nurse Emeritus when I was a nurse resident, and I had an amazing experience. It was so nice to have somebody who was sort of removed from the system a little bit to give me very unbiased support. I felt very safe with Miss Elise, and I was able to really share what I was going through without it being punitive or feeling something was going to happen because of it. It was just nice to have another shoulder to lean on, that somebody who had a lot of experience but wasn't necessarily in charge of what my day-to-day looked like.
Thank you. Thank you so much.
Thank you.
Elise, do you want to? We have just a little bit of time left, so just. Thank you so much, Caroline.
Hi,
Thank you.
good morning, everyone. My name is Elise Smythe, and I have worked at Jackson over 35 years and was happy to come back to help our new nurses. Jackson is my beloved. I love this hospital. It has done so much for myself and my family. And just the opportunity of coming and give back to our nurses and to the hospital was something that I embrace. And as Caroline said, that I was another shoulder to lean on, so to speak. And so we are happy. I am happy to be able to be here at Jackson and to make sure that our new nurses are protected. We say that with nurses, they're young, and so we're trying to avoid that here at Jackson so we can support our nurses and help them to fly, to do the best that they can without any punitive action or without any bullying or anything like that. So coming back here was something that I embrace and will always be thankful to be able to do something that I love. I'm naturally a person who loves to support and to encourage and to advocate. And so this is right up my alley, so to speak. So I enjoy this a lot. And one of the things that I teach the new nurses or share with them is to really learn how to use their skills, what they have learned so far, like the ABC system. I share that with them to use that and help them to how to manage their workload. What some of them asked me, well, Miss Elise, what do I do next? I said, okay, look at the ABC system. If this patient that you're taking care of really needs your help right now, use that system to say, okay, I'm going to give help to this patient because this patient needs my help. If, say, the breathing ABC system, as we say, if they need, if that can come afterward, then that goes afterwards. So we try to really give them something that they're familiar with so they can use that to develop a systematic approach to help them to problem solve. So I am enjoying it. I love it. And I hope that, you know, all new nurses are able to have this system that we develop here at Jackson.
Thank you so much, Elise. Thank you. So last year we did a poster. We composed a poster on the Nurse Emeritus program, and it was presented at the Nursing Consortium of South Florida's conference, and we won number one. We won first place for that poster, and that was a collaboration between myself, Susie, and Andrea Socorro. And just to conclude, it appears, and this is just as I said, it appears that the Nurse Emeritus program focused on the psychosocial support for new nurses, or for the most part Gen Zers born between 1997 and 2012, is an effective strategy to decrease attrition and maintain stability in the new to practice nurse population. Our outcomes bear this out. This support becomes even more effective, knowing that studies have demonstrated that Gen Zers are the generation with the most psychosocial challenges, as I mentioned before. The Nurse Emeritus program is designed to mitigate psychosocial stressors in this population and make those nurses successful. And these are our references. Thank you so much. That's my contact information. If anyone has any questions and they would like to reach out, please feel free to do so. We're willing to share. Thank you.
Thank you, Dr. Fray, for sharing how Jackson Health System's Nurse Emeritus program is making such a meaningful impact. It's clear how valuable this program has been in supporting new nurses and keeping that deep experience and wisdom within the organization. And we have questions that have been submitted, which we will address at the second part of the presentation. Please feel free to continue to submit your questions using the chat function in the webinar. Meanwhile, we've got a Slido poll. So before we move on to our next presenter, the Slido poll question is, this time we'd like to know, what do you see as the greatest benefit of a Nurse Emeritus program? Give it a couple seconds. See the poll moving around. Okay. Thanks for sharing. It's great to see what stands out the most to this group, which is the mentorship for new nurses. It's a nice balance. Now we'll hear from Dr. Valarie Grumme, Senior Director, RN Professional Development Programs at Memorial Health System in Hollywood, Florida, where the Nurse Emeritus role has been expanded to strengthen education, simulation, and mentorship across the organization.
Good morning, everyone. It's a pleasure to introduce myself here and to participate in this wonderful webinar about how we're supporting our nurses growing in their practice. So let me tell you a little bit about our Memorial Emeritus Nurse Program. So give you a little background, we took a little bit of a different spin with our Emeritus program. We found that post-COVID, we identified major gaps with skills and understanding and performing basic nursing skills. The students had no minimal or hands-on experience interacting with live patients because during COVID, there were no clinical practice, practicums or even Proctor Lab. Most of them was, virtual or through books. And the curriculums to some degree were outdated because the faculty hadn't been in the hospitals for a couple of years. So it really wasn't reflective of current practice, like, for example, diabetes protocols, blood transfusions, surgical protocols. We had nurses that had never seen a surgical drain or taken care of a post-op patient. So our solution was to create RN boot camps. So we had just opened our simulation center in 2022, and we decided to set up RN boot camp for all new nurse residents coming into our system. So there were separate boot camps for the adult population and the Joe DiMaggio population. And these boot camps were primarily staffed with our Emeritus RNs and from educators from our specific hospitals. All right, so how did we find these Emeritus RNs. All right, we went to our CNOs. We asked them for a list of all the retired RNs from the last years to review with their nurse managers. How would they identify who would be good candidates? We explained that these were going to be per diem positions over at our simulation center. They would be assisting with RN boot camp, competency validation, and mentoring. And so any current or retired per diem RNs in the system would be eligible to participate in the expertise because we wanted to use their expertise in practice. And to do that, you know, we made them feel very special. We introduced them as our Emeritus nurse team. We bought them lab coats with the memorial logo and the Emeritus RN identification. And so we were able to identify a core group of Emeritus RNs. We started out with 5 originally, and then eventually growing to 8 RNs. And it was very, very interesting. Some of the recruiting stories with some of the retired RNs that even kind of spread by word of mouth. We actually had one of our Emeritus nurses that had let her license expire. And when she heard we were having this Emeritus nurse program, she actually went back, got her contact hours that she needed to reinstate her license so that she could be part of the program. She was so excited to do that. We had another Emeritus nurse that was called by her director, one of her former directors, and said, you know, would you be interested in this program? And you know, first she thought it was going to be a volunteer. And then when she thought she was going to get paid, she's like, wow, this is like amazing. So very quickly, we assembled a core group of 5 Emeritus RNs to participate in activities over at our simulation center. And it's from a wide range of practice. We have retired educators, we have retired administrative officers, clinical ladder nurses, clinical managers, and staff RNs, and they have a wide range of skill sets. So what was this program? It was really an opportunity for us to let our retired nurses or our experienced flex schedule nurses share that amazing wealth of clinical and institutional knowledge that they have with our new graduate and specialty practice nurses. And we challenged them, let's put together a curriculum, let's coordinate with the delivery of the Sim Center activities, let's do some mentoring, let's make sure people understand regular retirements and use of clinical information technology. So we really, challenged the Emeritus nurses to be all that they could be and grow with all of the activities that we had at the Sim Center. And they also serve as consultants for staff in clinical practice and professional development. And I'll go into that a little later. All right. One of the most amazing teaching tools that you have is the power of story. It brings relevance to your practice and it creates a memory imprint for future practice. Our Emeritus nurses currently have over 270 years of nursing practice and institutional knowledge, and they share these experiences with our nurses during RN boot camp and other educational event. So at every station, there's stories, both good and bad, that support the learning experience as far as that goes. Some of the key experience we talk about, we talk about chest tubes, we talk about surgical drains, we talk about cardiac drug administration, hypoglycemic episodes, and I'll give you a perfect example of one of the great feedback that we got from our nurses that went through boot camp. We had an experience where we actually got a phone call over at our Sim Center that there was a nurse, a new graduate nurse that was with her preceptor over at one of our hospitals. And they were attending to a patient, caring for a patient that had a chest tube, and the patient was having some respiratory distress. And the new nurse immediately went over to the chest tube and noticed that there was like continuous bubbling going on, that it was, she identified as a serious issue, that, that they had a leak and they had to call the physician right away. The patient was in distress. And, when we got the feedback on this, it was, how did you know about this as a new nurse? She says, oh, I learned about it in boot camp, and so it was a great story. It was a great validation of some of the work we do over there. Also about surgical drains. Like I said, most of our new nurses have never seen surgical drains because they had no OR experience or clinical practicums on floors with surgical patients. So we tell them the story of a patient who had a surgical drain that came out when they were moving in bed, and the nurse found the drain in the bed, called the physician, unknown to the nurse that the drain had actually snapped, not broken, and part of it had actually recessed back into the patient. And so that created a whole sequela of events, where the patient had to go back to the OR and take care of, and receive further antibiotics and other treatment. And now when they hear these stories, if they hear that they see a drain, that, they hear a snap, that the drain is broken, or, they find it in the bed, they know to immediately get a hold of the surgeon, that they need to do some imaging to find out there's no retained product inside the patient, and, take care of all these issues immediately. So these are great stories that they share. Also, hypoglycemic episodes, where a nurse, might notice a patient is having some confusion or mimicking stroke symptoms, but when they have, and when they check the blood sugar, they check the blood sugar and it's like 65. So every time we give them examples of these kind of patient episodes, they remember this and they can use it in their practice. And these are just some of the reflections from surveys that we've had from our bootcamp attendees with learning with the Emeritus RNs. They felt very safe. We emphasize that this is a non-judgmental, this is a learning area. We want you to make mistakes so that you can learn to do it the right way and then do it right when you're there with practicing on a real patient. And they felt they were very safe to make a mistake and learn the right way to perform a sterile procedure, that they made me feel so comfortable to ask questions, that they learned important information about the stories from the chest tubes and the surgical drains. They recognized the importance of asking for help when needed. That's really an important thing that new nurses need to learn, that sometimes they're afraid to ask for help because they don't want to feel stupid, or that they, the impression is that they don't know. It's that, we impress upon them it's important to ask for help when needed. They learned about their advanced nursing interventions and what they could do to immediately care for the patient, patient deterioration, that they felt more confident communicating concerns about the patient. And then just in general, everything we learned in the boot camp, we use on the floor. It sets such a great foundation. So our Emeritus nurses are doing a wonderful job with teaching our new nurses and our other specialty practice nurses.
I was not ready to retire when I retired. So when I received a phone call from my former director telling me this job, coming back as a retired nurse to work with the future of a profession that I love dearly, I jumped at the opportunity. We have one of our boot camps going on today. This is required onboarding, and they go through a full day of skills related. But what's really special about our boot camps is that we have our team of Emeritus RNs here. And our Emeritus RNs have been here since the opening. Emeritus RNs are nurses that used to work in our system that have retired, but now have come back to us to work in the simulation center to help teach our new nurses. And between the 8 Emeritus RNs that we have right now, over 270 years of nursing experience. You cannot buy that kind of experience.
So with the experience of the Emeritus nurses, you were able to really gain so much knowledge, and they were able to educate us on various skills and their experiences, and you pick up on the little cues that they would tell us. From our fall prevention, from our IVs, from our catheter placement for our chest tubes, everything that we learn here, I can't pinpoint one specific thing, but everything that we learned in the program, in the boot camp, we use on the floor.
Invaluable little hints, tricks of the trade, everything that they need to know. The Emeritus nurses give that wonderful expertise to them. And yet, like I said, you can't buy that kind of knowledge. Just some expanded roles that we have now included with our Emeritus RN program because our boot camps have been so successful. We've added a refresh to acute care fellowship boot camp. That's for nurses that are coming in from outside of acute care, such as long-term care or a doctor's office that now want to practice in acute care. We send them to boot camp for a month at our simulation center, and that is run by our Emeritus nurses and our educators at the Sim Center. They participate in teaching basic arrhythmia, American Heart Code, BLS, ACLS renewals, RN clinical improvement courses for nurses that need a little bit more help with their onboarding. Because of their specialty expertise, the educators also know that they can call our SIM center and request a specialty consult with our emeritus nurses so they can give them some one-on-one time to assess skills and to remediate some of their practice. They participate in our PCA boot camps, our monitor technician annual updates, our just recently added medical assistant boot camp, and EVS safety and infection control. So they have a wide range of opportunities to help grow the next generation of not only nurses, but all of our allied health practitioners as well. So it's been a very successful program for us. And some of our expanded roles to assist with mentoring of our new nurse residents and fellows with clinical reflections, actually going into the units and with our coordinators and doing quality assurance rounds, unit-based assistance with PIQI projects and regulatory readiness, and other unit-based activities. So these are some future opportunities that we see in expanded roles for our Emeritus RN program. And it was wonderful this year that as a healthcare system, we recognized our emeritus nurses during Nurses Week for all of the wonderful work that they do in growing our next generation of practitioners. And I just want to say thank you to our emeritus nurse team. They are wonderful. They give such joy and happiness to all of the students that come through our SIM Center. And last year we had over 4,000 students of RNs and allied health practitioners come through our SIM Center, and they are an integral part of our practice there. So thank you very much. And these are our references and my contact information. Be glad to explain about our boot camp programs and some of the other work that our emeritus nurses do. So thank you.
Thank you, Dr. Grumme, for sharing how Memorial Health Systems has built such a dynamic and innovative Nurse Emeritus program to strengthen education, simulation, and mentorship. It's clear from both presentations that these programs can take many forms, but they share a common goal: keeping nursing experience and wisdom active in the workforce. All right, for our next Slido poll, what is the biggest barrier to implementing a Nurse Emeritus program? We see some people participating. Okay. Everyone sharing its input. Thank you. I love all the participation. Sharing input. It's really helpful to see what challenges stand out the most. See funding, organizational leadership buy-in. Many RNs, cost, budget. This is the second time I've seen budget come up. You can use the QR code, or again, you can do the slido.com and put in that number. Funding, organizational leadership buy-in, and budget. Very interesting. Looks like funding is the highest. Thank you for all the responses. It really highlights just how important collaboration and creativity and leadership support are making programs like this successful. Okay. We will now address some questions that have come from the audience in the chat. Additionally, you can share any key takeaways or questions you have. Again, use the chat using the chat function. We'll take as many as we can while the time allows us. So let's take a look at the chat. If I can have, let's see. Let me open up. Dr. Fray and Dr. Grumme can get back on. And let's go through some of these
My
questions.
camera is disabled.
There you go.
My camera has been disabled.
Your camera's been disabled? That's all right. We can hear you. Okay, let's take a look. First question came in. They
Okay,
wanted
there I
someone
am.
to elaborate. Oh, there you go. There's the camera. Thank you, Dr. Can you please elaborate on the boot camp? Was that something, Dr. Grumme, was that you?
That's Dr. Grumme.
You're on mute. Dr.
You're
Grumme,
me.
you're on mute.
Can everybody hear me now?
Yes.
Great.
we can.
Okay, RN boot camp for nurse residents is a mandatory 2-day boot camp that covers essentially 16 core skills that have been identified that a basic med-surg tele nurse would need to know to be successful in practice. And like I said, many of these core skills they've maybe touched on in a sim lab in their nursing school, but many of them have never had a chance to put hands on or actually practice with a patient due to limited clinical practicums or whatever. So just, basic things like drawing blood, IV therapy, chest tube management, surgical drain management, how to suction a patient, oxygen therapy, documentation, time, all of these basic, putting in a Foley catheter because Foleys, are not used as much as they used to be because of CAUTI infection reduction. So many new nurses have never had the opportunity to place a Foley catheter. So when they have to, it's a knowledge deficit. So they actually get to practice that in the sim lab, both on male and female simulators. And all of these, core practice skills are really, really important. And what's good is the emeritus nurses have a story about everything. So they can tell them, okay, well, if you do this, watch for this. Or if you see this happen, you need to get some help right away. Or if if you can't do this, make sure you ask for help. But they get the opportunity to make mistakes, and that gives them confidence in their practice. So when they go to a real patient, that they know how to do it right. And I think I exemplified that when I told the story about the chest tube. They were just so impressed that the new nurse was knew exactly what to do with that chest tube and reported it right away, and the patient got taken care of right away. So they learn these things, and they learn through the stories that the emeritus nurses tell, and that's very powerful.
Thank you for sharing that.
Annabelle's hand was up. Annabelle?
Hi, good morning, everyone. So I have Tessie here, and then I believe Julene is on the call as well, and they wanted to speak on behalf of the program. Can you hear me?
Yes, we
Yeah.
can.
Okay, give me 1 second. Okay, I don't know, my camera is disabled, but I have Tessie here. She's going to speak on behalf of the program.
Okay.
So my name is Tessie, and I've been in the nursing profession for 47 years. Mentorship is very dear to my heart because in my 47 years of practice, I have greatly benefited from being a mentee in my clinical areas and as a leader. I have been given the opportunity of being a mentor to clinicians and leaders as well. And I am so grateful to pay it forward. To support Jackson's new to practice nurses in their process of integrating into the workplace, I incorporate the healthy work environment that is originated by the AACN program. And I have discovered through my conversation with the new residents that communication is extremely important in their professional development. We ensure that their experience is a positive one. And the first thing that I do as a nurse emeritus is to evaluate their psychosocial emotional level of their well-being in other words, because I start knowing who they are. That's my first approach, because I try to individualize my approach to each and every resident. I start finding out their background, their interest, because anxiety and apprehension during their first entry in the clinical profession is really very important. And that's one of my purposes in meeting their need, reduce anxiety. Once you reduce their anxiety, they are very good to tackling their clinical challenges. Because also I found out that it's very hard for them to retain the knowledge that they gain and integrate into the clinical practice. So by knowing their personalities, their challenges, I am able to approach and make their orientation easier and more meaningful.
Thank you for sharing that. I appreciate that. Fabulous. Thank you so much.
Thank you.
Okay. Thank you to our presenters for their willingness to share their knowledge and experiences, and thank you for attending the Florida Center for Nursing's Legacy and Practice, the Nurse Emeritus Role. I hope you found the information valuable and gained new insights. We are delighted that you joined us for this webinar session and ask that you please complete the evaluation, which can be accessed by scanning the QR code on your screen. Your feedback and suggestions are appreciated and used to improve and expand our program offerings. Thank you.